We would like to welcome you to our HR Power Hour. And this, we will be covering getting back to work after COVID-19 and just going over a few things that we think are really important for everyone to know in this process. And we're hoping that it'll be helpful for you and your business. So at this time, I'm going to turn it over to Sarah to get started.
Thank you, Alicia.
You're welcome.
Welcome. Thank you. And welcome, everybody. And we're glad to have you back at another HR Power Hour. We are getting closer to shifting back to what might be a new normal. Um, and we are going to be talking about getting back to work today. A couple things I just wanted to let you all know that we do have the Q&A box, and I encourage you to ask questions in there. Alicia will try to answer those throughout the presentation, and as we get at the end, at the end we will follow up with any other questions that she hasn't answered or that might be relevant to everybody that we want to make sure everybody hears the answers to. So my name is Sarah Skoronsky. I'm the principal consultant at EOS Human Resources Consulting. We work with a number of small businesses throughout the Bay Area and throughout the country. And I'm excited to introduce you to our newest team member, Suzanne Crest, is joining us from Denver now. We expanded outside of just California, and we have our first multi-state employee. And Suzanne and I actually started in HR together way back when, and she has gone her path in Denver, the area, and I'm excited that our paths are now joined again and that she's joining us to just to help support our clients. Welcome, Suzanne.
Thank you.
So today we're going to be talking about preparing for recalling your employees, addressing the new safety concerns we need to be aware of, considerations for compensation, reminders for reinstated and new employees, so the people that you've laid off and anybody that you hired during this time, and then some recommendations and requirements about policies. So to get started, we're going to get back to work here. We don't exactly know when, but one thing we know for sure is that the day that they say we can go back to work, we can't all just rush out and get back to work. We're going to have to phase this in. We are going to have to take our time and make sure that we do this thoughtfully and safely for our employees and for the public in general. So a couple things that we are recommending. One is to find a way to stagger the return of your employees. You don't want to have everybody come back to work at once and try to manage all of the different rules and the new requirements that we'll be going through in terms of safety. So if at all possible, you want to continue to allow employees to work from home, maybe have some people work a couple days in the office and alternate. This is also a good way to maintain the social distancing within your offices so that people are not necessarily working right next to each other. You need to remember that COVID-19 is not going away as much as we really want it to, and we are so ready for it. It may flare back up. We may have to do another round of stay at home. We're hoping that is not the case. We're hoping by putting these safety measures into place now and really holding our employees and our businesses accountable to that, we'll be able to steer away from that. But we need to realize that COVID-19 is still out there, and we need to be as safe as possible. We also need to be flexible. The things that are coming up during the stay-at-home orders are still going to be there. The kids are not going back to school. There's the daycare solutions are not at full steam. So people still need to be able to take care of their families, take care of their loved ones, take care of their children. And so it's important for employers to maintain that flexibility and and where possible, utilize the tools within the FFCRA rules and different laws to make sure that employees are getting the support they need. And then last on this slide is make sure that people know how excited we are that we are back, that we are coming back. Do something to make sure people know that they're welcome. It could be something as silly as getting everybody their own face mask, getting one that has a logo of the company on it, although some logos might look strange on covering people's faces, but you do want to do something to let everybody know that we're in this together. And so it's important to have that camaraderie when people are returning to work. When you're deciding who is coming back to work, the things that keep in mind is that most of the people that are probably listening to this are not in that very high risk healthcare worker category, but you still need to look at what type of interactions that you're having. Are your employees working with the public? Are they in any kind of delivery situation where they're not within your control? Or are they just working in a retail space or an office space and they're working, again, do you have control over the people that are coming into the office? Or is it really that just the workers are going to be in the office and you can maintain that control and maintain some level of sterilization and quarantine for the employees? And then there's a question of what if employees do not want to come back to work? So right now we are in a phase where if employees are able to get their unemployment checks from EDD or from whatever state government, that check may actually be more than what they might get when they're working for you. And so they may prefer to stay at home. It is important to know that the government is working really hard to get everybody off of unemployment. They are completely overwhelmed. They do not want to be paying these fees out. They don't want the states to be paying that out, and they don't want the federal government to be paying out that additional $600. So if the employee is refusing to work, it is your responsibility as an employer to document that and to make sure that they know they are in jeopardy of losing their unemployment. At some point, the EDD will catch up. It may take a little while, but they will catch up. And they will start to send out benefit audits where they're asking when did the employees come back to work. And if the employee falsely said that they were unemployed, they're going to be responsible for paying that money back to the government. And that can be a hardship if they've already spent that money. So make sure that when you're talking to employees about coming back to work, if they are saying they don't want to, that they'd rather stay on unemployment, make sure they know that once you have offered them a position, it is their responsibility to accept it, or they may lose their unemployment benefits. You also want to make sure that you are creating some sort of training or other employee education for your employees upon return. Suzanne is going to go through a lot of the safety measures that need to be put into place. And it's important not just to put them into place, but to make sure that your employees are actually taking action on them. Are you going to require them to wear a face mask and gloves while they're working? Are you going to require them to have any other protective equipment on while they're at work or while they're interacting with clients or with customers? Anything that you're asking them to do that's out of the norm of what they were doing before, you need to make sure that you're training them and that they understand what's expected and how to do it. And finally, you want to make sure that you're communicating whatever your plans are with the employees. Every time you communicate with your employee, that creates a level of transparency and it makes the employee feel safer and more secure about what's happening. Again, I can't emphasize enough that creating that communication, having that interaction with your employees is going to maintain their trust, is going to increase their trust in coming back to work and feeling like it is a safe place to return to. So when you are communicating with them, let them know what you've done before they return to work. And again, Suzanne's going to go through a lot of this in detail, but all of the cleaning and all the different steps that you have have done to make sure that the workplace is a safe place to return to. Tell them what to expect on their first day. Let them know, are you going to start with a training? Are you going to start with them getting right back to work? Are they expected to be wearing masks? What do they need to do on that first day? Be clear about what time they should arrive, because you are possibly adjusting things and adjusting your schedule. You want to make sure that everybody is clear about what you're expecting of them. If anybody who has done any work with me knows that one of the first things I say is you need to set clear expectations with your employees, and this does not change now. You cannot expect them to know that you only want 3 of them to show up when there's 5 of them, and you can't expect them to know that you don't want them to show up until 10 when they normally show up at 8. So be very specific and very clear about what you expect of them. And again, all of this communication allows for that transparency. Let them know if this is still an unstable time, because it's unstable for a lot of companies. But you don't want to give them a false sense of security if things are still up in the air, if you're still in a place where you don't know if you can afford to keep them on. Be as transparent as possible. It might cause them anxiety, but in the bigger picture, they're not anxious about not knowing. They're able to start to plan and make some decisions for themselves going forward. So now we're going to shift into that workplace safety and what needs to be done. And so I'm going to turn it over to Suzanne, and she can talk a little bit about, well, not a little bit, actually a lot about workplace safety and what we need to do to prepare our workplace for post-COVID.
Great, thank you, Sarah. If you could imagine your employee coming back to work, if they don't want to come back to work, it's probably because they're afraid. And so what we want to equip you with is a way to make sure that you do things. These are the basic things, but you check them off so that you can reassure your employees that it's safe. The basic step 1 is to check and see if you have supplies. You got to make sure that you have soap. Soap and water is still the #1 way to remove the virus from yourself. Disinfectant, hand sanitizers, make sure everybody has paper towels and tissues so that they're not reusing anything. So you definitely want to check out that stuff before your employees come back. Also, think about who's going to clean the office. You may have professional cleaners, it may be you, but someone should clean the office with proper disinfectant and doing it properly. There's a link in this slide deck that takes you to a list from the EPA that states that these products are effective against this type of virus. But it also states that there are some products where you have to leave them on for at least 10 minutes for them to actually kill the virus from the surface. So you want to make sure that you're using the right materials. I think it's a good time to ask your HVAC vendor to come over and check the ventilation system. If you don't have one, obviously check it yourself. Again, just the basics. Probably a good time to change the filter. Good time to check and make sure it's the right size. Make sure it's a decent filter. This is an airborne virus, so that's something that we definitely want to do. And then we're still doing social distancing. And basically in your workplace, if you imagine it as it normally is, people are constantly around each other, touching the same things, going in and out of rooms together. So what you want to do is take a look and see if you can remove some chairs from conference rooms to, again, to deter people from gathering there. I also suggest, if you have a large bathroom, to make a way to make sure that there's only one employee in that bathroom at a time, if you can. You might want to rope off certain areas, or you might want to put up some kind of barrier or partition. And you definitely want to make sure that employees are apart when they're at work. So That may mean moving desks, moving chairs, so that they do not have to be less than 6 feet from their coworker. Providing personal protective equipment. I don't know that all of you know what PPE is. That's what it stands for. It's usually a fancy term we use for using respirators and things like that at work, but now we're talking about, again, the basics. Please know that OSHA says that you have to give your employees a safe workplace. And based on that, we highly recommend that you purchase PPE and distribute it to your employees and not have them go out and do it on their own, not have them have their own mask and put it on and bring it in. Make sure that you are thinking about the risks to the worker. You know, when Sarah was talking earlier about the risk categories, think about, are these employees around each other all the time? Is there just one person in the office at a time? And I would definitely recommend getting the basics. I, as an employee, would feel safer if I knew that I could grab a mask or grab gloves at work and not worry so much. So that's the goal here. Also, what I found is that not everyone knows how to use gloves or how to use a mask. Can you reuse any of it? Should you reuse any of it? What are you recommending? So that's another piece. And just yesterday, an article came out about the new California executive order. And it basically states, in California only, it basically states that if your employee gets COVID-19, it's because they got it at work. It's presumed that they got it at work, meaning unless you can come up with some magical way to prove that they didn't get it at work, in order to combat this, the best you can do is to prove that you are doing everything you can to keep your employees safe. That way, COVID isn't in your workplace and you won't have to worry about paying workers' comp injury for someone contracting the illness. We definitely encourage you to put up signs. I know it seems like common sense, but the more that we can get our employees to focus on this, you know, they've been home for a long time, and so they may be lax with some of these things. Make sure that they know to wash their hands and to keep their distance, and they need proper respiratory etiquette. That's my favorite term right now. And that's important because you just want to remind them constantly. So should you check employees' temperatures? You could, and you can. But remember, just because an employee has a temperature doesn't mean that they have COVID. So it's not a be all end all, but one thing you can do is think, okay, if I knew somebody had a fever, I could send them home right away. That's fine, but these are the risks that to mitigate when you're doing that. These are the pros and cons of trying to mitigate the risk. So first of all, it's permitted by the EEOC, which stands for Equal Employment Opportunity Commission. For those of you who don't know, we use lots of words in HR land. It's currently widely used. I'm sure you've seen airports screening their travelers this way. It can help you decide to send an employee home right away and make sure that they haven't come in contact with anyone. Anyone can actually take the employee's temperature as long as they're safely trained and know what they're doing. Although it is preferred if you have a medical professional on site to have them do it. The cons are, when you take an employee's temperature, that's a medical evaluation according to the Americans with Disabilities Act. So now you're talking about personal health information for these folks that you're supposed to be handling confidentially. So having access to that kind of information can get tricky. Like I said before, you could let somebody in, they don't have a fever, but they have COVID, because fever is only one of the symptoms of COVID-19. It's possible that your employees, this could really put them off. I could see it both ways. I think some employees would feel more comfortable, others will not. And then you have to think about, well, if they don't want to, then do I just tell them to go home? And then you've got absentee issues, you've got basically different disciplinary issues that you don't really want to get into. So that's something to consider. And then finally, I don't think all of us have contactless instruments to take temperature. And they suggest that the person taking the temperature has PPE on, pretty much a full gown, gloves, etc. So that would also take a lot to set that up. So think about it, if it's right for your employees or not. So finally, again, I'm sticking to the basics. So you want to make sure your employees are safe at work. Try to make sure that they're still doing video meetings. No handshaking with clients or each other. The other day, we thought about ordering some business cards for me since I'm a new employee, but that would be the last thing that we would want to do right now, because I don't want to hand something to someone like that. Think about the printer and the scanner. If people are constantly printing out documents, they're going to be constantly touching the printer. Try to make sure your employees minimize printing as much as possible and review things on their screens. We talked about moving offices around, making sure people sit apart, making sure they're not sharing an office, and make sure that you've cleaned once. You want to make sure that you're going to clean going forward. Another, again, it's a basic thing, but open the windows. If you have windows, open them. Fresh air is a good thing. Think about the coffee pot and the refrigerator, and these are things that people touch all the time. Now, am I recommending that you get everyone a Keurig? Maybe not. That could be nice, but you may just ask them to please, that we're not doing that right now. And if you want to get coffee, that's your own business. I don't know if some of you have been hiring, but continue to screen those employees either on video call, phone call, video call, and then only the final candidates should be actually coming in person. To me, I would like to meet them in person, but I know people lately who have hired without seeing these folks in person because of the situation. Remember to explain to your employees what they can and can't do for travel. Even though you've said this before, if you are sick, stay home, period. Do not come into the office. And along the sickness lines, I want to remind everyone that mental health illness is also one part of what's going on right now. Your employees can be having a really hard time. If you imagine they're at home, they're homeschooling, they can't go anywhere, their kids can't go to the bounce house, and it could be very stressful. So make sure that you know that that's a part of your overall employee wellness and safety.
All right, thank you very much,
Thank
Suzanne.
you.
So now we're going to shift gears and talk about some other considerations. One thing is in terms of compensation, and the first part of this is considering rate increase and decreases. So in some organizations, you have a set date where you are doing increases, and sometimes that's at the beginning of the year, so maybe you've already adjusted for that. Sometimes that is at the middle of the year. For some of my clients, I know it was right when we all went on a shelter-in-place order. So we want to make sure that you're addressing this. I'm not saying that you have to now go and do those increases, but at least let people know what is going to happen. Are they going to happen? Are they not going to happen? Have they been postponed for a certain amount of time, or have they been canceled for this year because of the way the financial financial stability of the company and the economy is right now? On the other end of that is if you have, or if you need to actually cut and decrease people's compensation, make sure that you are evaluating that across the board. Make sure that it's not, you're making a decision that if it was looked at from 30,000 feet, it does not look like you're discriminating against any specific group or protected category. You want to have those cuts in pay done fairly and done in a way that is not alienating any person at all, so that they understand that this is something that the company has to do across the board. For your employees who get a variable compensation, such as a bonus or a commission that's tied to production, look at how you might need to restructure and redesign that plan. Do the goals need to be adjusted for those employees? Is the bonus in line with what you want to and are able to pay out to these employees? This is a whole new way that we need to think about things, and we need to consider not only what was promised before, but what we're able to achieve. And if you don't address this now, then as the time goes on, the employees are going to expect whatever was in writing before. So you can't just change something midstream if you have made a promise to them of how they're going to earn commissions or how they're going to earn bonuses. So that this needs to be addressed immediately so that those adjustments can be taken into account. In some situations, you might consider hazard pay. If you're in a situation where they do have contact with a large number of people, if they have contact, if you're not able to maintain that social distance between people, it's not something that's required. In fact, it's not even necessarily required for all of the healthcare workers that are out there, but it is something you may want to consider in terms of bringing people back. Again, this is going to be a case-by-case basis. How much danger are they in would be what you would be looking at to determine if you're going to pay them hazard pay. And finally, on compensation, look at your overall company health. This is your overall company financial health. This has been a very stressful time for a lot of companies. Not everybody got PPP loans. There is a lot of uncertainty happening. So make sure that whatever you decide to do moving forward, you can support that expense. You don't want to make a promise to somebody that you're going to bring them back the same compensation, the same commission structure, the same rate, and then realize that your sales have slowed down so much that you're not able to support that. So just be very realistic with yourself and with your employees on how this is going to affect everybody.
Sarah, I think Alicia had something to say. Alicia.
Did you want to add something, Alicia?
Yes, thank you. I was trying to sneak that in there before you before you move to the next slide.
Thank you.
I just wanted to, while you were talking about companies having to possibly do rate decreases, I just wanted to throw out there that you also have to be aware, if you need to do that, of if you have exempt employees versus non-exempt employees, and the implications of taking an exempt employee down to a rate that may take away their exemption status. And so there are, laws on that that require that they be paid at a certain amount. And also with non-exempt employees, just making sure that they're paid at least the minimum wage for, if not state, for your local area. So I just wanted to, when you touched on that, that came up, and I just wanted to throw that out there.
Thank you for that reminder, Alicia. Yes, that is a very important thing to make sure that you're not violating any wage and hour laws. That's always something that we need to tie back to, and all of these things, again, the change of rates, the change in variable compensations, you need to make sure you're doing this within the wage and hour laws. So thank you for that reminder. All right, the next thing we're going to talk about is your furloughed employees. And I think we've I said it at the beginning, Suzanne, I think, has said it in part of safety. You don't need to bring everybody back at once. However, going back to that transparency and that communication, if you're not going to bring people back, especially if you said, we're looking at bringing people back by this time, if you're choosing to delay somebody's return, make sure that you're communicating that to them. Make sure you're communicating why. If it's because maybe their department is not necessary, or you only need one person in that department to kind of get things back up. Whatever that reasoning is, make sure that you're documenting it again and again, that you're making those decisions without bias towards any discriminatory reasons. So it's important to, again, look at it from that 30,000 feet of, okay, this is the plan I'm going to make. I'm going to either have this department come back, and so everybody in that department is coming back, or I'm going to have one person from each department come back. However you're going to do that, but make sure you have a plan and you can communicate what that plan is to both the people that are coming back as well as people who you might not be ready to bring back on. This could be an issue with safety, or it could be an issue with money. Again, there is, I alluded to the PPP loans. Some people have received those. You have to use that money within 8 weeks. So there may also be the chance, and this again, you need to communicate with them, that you may bring them back and you may have to put them back on furlough if the money runs out and we're not to a place where business is starting to move again. So if you need to use that PPP money, remember, and you can go back and watch the video on the PPP and making sure that you are getting it as forgiven as possible. You need to use 75% of that money towards payroll costs, even if you bring the person back, or even if they're not working. You want to make sure you're paying that on payroll costs. But when that money runs out, and if you need to put that person back on furlough, make sure you're communicating that to them as soon as you know, and as soon as you recognize that that may be an issue. If you had employees that you actually laid off and you want to reinstate them, remember when you laid them off, unlike the furlough, which was a unpaid leave, so basically everything stayed, they stayed as an employee, maybe an inactive employee. But when you've laid somebody off, you have terminated their employment. So now they need to be treated in some ways like a new employee. So they need to complete rehire paperwork. They need to make sure that you get them set back up in the payroll system. They need to fill out all of those forms again to do that. For the I-9, I believe you have several months before you would have to recertify them. So you don't have to worry about that if it hasn't been too long. But you do want to make sure that you get all that documentation. And this could potentially be, this is the good time to document any terms that they're coming back to that may have changed. So if their compensation is changing, if the terms of their variable comp is changing, make sure that that's all documented in an updated offer letter, so that they have that information coming into it and they know what to expect. If you were one of the lucky few who were actually hiring people during this time, it was kind of a scramble. We were all running around. We couldn't complete the I-9s properly because we couldn't actually meet people in person to verify their identifications. You may have kind of slopped everything together to get them on board and get them into payroll. This is the time to go back and audit those files. Make sure that all of the new hire forms are completed, all of the required forms such as the I-9 are completed. Make sure somebody's actually visually and physically reviewing the forms of ID for those employees. And if you have a normal onboarding process that maybe is an in-person onboarding process and you didn't have a chance to shift that to a virtual onboarding process, make sure that the new employee is going through that so that they feel strong and secure in their position, and they feel like they know what's expected of them and how to maneuver within the organization. We're going to shift to policies. And if you've heard any of my previous talks, you will recognize almost all of these policies because I've tried to hammer them home since almost day one. The FFCRA is the Family First Coronavirus Response Act that brought the emergency paid sick leave policy and the emergency family medical leave policy. Again, I want to remind everybody that even though we're going back to work, these policies are still in place. You're required to offer these to your employees through the end of December of this year. It also is good practice to make sure you have a written request for any of those leaves so that you can track that. Remember that the EPSL and the EFMLA, those are reimbursed. The cost of that is reimbursed to the employer by the government. And anytime the government gives you money, even if they just hand it to you right now, eventually they're going to want to audit and they're going to want to know why you are paid out that money or took that tax credit. So make sure you have that information available to as a justification for that. If you are continuing to allow people to work from home, it's very important to have that work from home policy so that people know what's expected of them, when they're expected to be working, what the results are that you're expecting from them. The social distancing policy, as we bring people back into work, it's important to have this policy so that people understand how you are addressing social distancing and how you are addressing infectious disease policy or infectious disease problems or potential problems, so that again the employees feel safe coming back to work and that they have the information again for that policy and how that will be working. And the last one is one that I've actually been thinking about a lot over the past 6 weeks is, do you have a business continuity plan in place? And if you don't have one already in place, or if you're not already working on one, now is the time to start working on this. And this is really, especially for smaller businesses, this is making sure people know what to do if something happens. Nobody is immune to coronavirus, unfortunately. While we have maintained our safety during this shelter in place, now we're going back out into the world. We could be exposed to this virus. What is going to happen if somebody who is essential to the business is exposed to this virus and is unable to work, or God forbid, anything worse than that? So it's important to build a continuity plan to make sure that people know, how do you pay bills? How do you send out invoices? How do you run payroll? Along with the bigger things of who's responsible for the business if that business leader is not there or not available. So there's a number of resources for that online in creating that, but I highly encourage you to start thinking about that if you haven't already. So backtracking to my favorite topic, which after December 31st, I hope I don't have to talk about anymore, but is the Families First Coronavirus Response Act. Remember, this went into effect on April 1st of this year and goes through the end of the year. And it's important to let employees know that this is an option. I'm starting to get more and more calls about employees who need to take care of their child, or whose doctor is telling them to self-quarantine, and the employer is not sure what to do. This is what you do. This outlines it specifically. So it's also important to know that there are some additional statutes, especially in California. We like to be special. California's food sector employees have a special call out around this. San Francisco County and San Jose have their own ordinances around this, and Oakland is working on an ordinance right now. So they have things that call out not just the small employers, but the large employers as well, that they are responsible for offering this to employees. It created, so the federal ordinance created it for employees with 500 or less employees. These local ordinances are including larger employers in the group, and it creates the paid sick leave, which is 10 days of sick leave for 6 different reasons. The expansion of or the Emergency Family Medical Leave Act, that covers employees who need to take care of their child and are unable to telework or telecommute while they're taking care of their child because the child is out of school or out of daycare. This is a benefit that is the employer pays to the employee and then is reimbursed through payroll tax credit reduction or payroll tax reduction directly off of pay stubs. So it is something that the employer will be reimbursed for. And so as we wrap up, we're not going to leave you empty-handed. So Suzanne, do you want to talk a little bit about the return to work checklist?
Sure, thanks, Sarah. We wanted you to have a checklist for what to do before and what to do after employees return to work. You can Google it and find a lot of different kinds, but we tried to make it as simplified as possible and with specific things that you can do to be ready. So you might have already thought about these things, but maybe there's something that you didn't think about that's on the checklist and that could help you. So feel free to download the checklist and use it as you would like.
So we do have a link that you can use to download the checklist directly. We also will be, I usually send out a summary and a link to the video and the slides afterwards. We'll send out a link to download the checklist as well when we send that out. But I wanted to make sure for people who wanted to download this right away, I don't always get that email out until Monday. So if you wanted to see this beforehand, you can use that link to download it. And as always, I wanted to, we're probably going to carry this package on through the end of May. This is our pandemic policy package where EOSHR can create those FFCRA policies for you, as well as the social distancing and the work from home policies. We offer a phone consultation where we go through these policies, make sure you understand how to implement these into your workplace, as well as language to send this out to your employees so that they understand what is available to them. It's a value of $149, and we're offering it to our members that participate in the webinars for $99. So if you'd like to take advantage of that, you can go to go.eoshr.com/COVID and sign up for that package. And finally, before we turn it over to questions, I just wanted to remind everybody that along with the HR Power Hours, which we are doing every other week, on the alternate weeks, I'm partnering with Laura Renner of Freedom Makers on our Remote Strong series, where we're taking a deeper dive into some of the ways to work with your remote employees and your distributed teams to make sure that you're working with them effectively. This next week is kind of my bread and butter is keeping it legal. We're going to really dig into the things that you need to know about employing people who are not in your workplace, that they're actually working from home, and how to make sure that you're keeping that legal. So that's next Thursday at 11 a.m. and we hope you can join us for that. And with that, I'm going to turn it over to Alicia and find out if there's any questions that we can answer.
Thanks, Sarah. So at this time, I don't see any questions that have come in via chat or on the Q&A board. Please, if anyone has any questions, please feel free. We'll take a couple of seconds to see if you want to get anything in there.
Yeah, I think it's in general, this is still evolving and changing, and I think it's important for everybody to be as flexible and as thoughtful as possible during this time. There's so many little things and so many nuances that we could have gone through. I mean, we can talk about like really getting into scouring and cleaning and all of that disinfecting that needs to be done, and monitoring employees, and the hope is that employees will be able to kind of catch a rhythm of this is the new normal. You know, hopefully they have been going out and going to stores and wearing the masks already, so they're not going to be as resistant to that. But having to wear it all day, you might have to kind of push them towards that. So this is just being patient with everybody as we continue down the path.
We did have one question that just came in, and it says basically if you've tested once, should you test more than once? And that is a very murky area. So
If you test,
Sarah, I'll let you go ahead and your Susan.
If you're, I guess is the question if you're testing, if they're testing like their temperature, or if they're testing the, or if you're just testing for COVID. I don't know that we actually talked about actually testing for COVID, but if you're talking about testing
temperature.
I would
testing
say
temperature.
that would be something you'd want to do, have a time where people are doing it when they're coming in. So you would actually be doing that every day. Somebody would be responsible for doing that every day, because they could come in tomorrow and have a fever.
Right.
So the gestation period of this virus is at least 14 days. So any other questions?
Right. Yes, I agree.
Yeah.
I was just gonna say, yeah, if you are choosing to testing temperature, then yeah, every day. Let's see. That's all the questions we have for now.
All right. Well, with that, I will wrap it up. Thank you so much for joining us again today. Suzanne, welcome to our team, and thank you for helping me out today. And Alicia, thank you for facilitating as always. And if you need anything from us, we are here for you. You can email us at hr@eoshr.com, or you can call us at 510-822-2080, and we would be happy to help. Thank you, everybody. Have a great weekend.